This is Hold My Stethoscope.
Hey everyone, welcome back. We have a very special guest this week on Hold My Stethoscope. So, welcome back. I'm Brittney, and I've got my wonderful co host Felicia back from New York.
Yay! Hi, everybody.
And then we've got our lovely friend Thomas back.
Hey guys, glad to be back. Thanks for having me.
Yes, it's been a while since we've seen Dom, and then Felicia's been, hanging out away from us in the cold weather. So I feel like we've got a few
Yep.
things to talk about today. We are going to just get started with our, moment where we listen in and really looking at the social media post I did last week for our episode, which, guys, you guys loved. So we were talking about last week in our last episode, kind of patients in the emergency department. And the clip I posted was about Felicia talking about a family member who came while we were doing compressions on a patient to ask for a warm blanket. And it just made me realize like how many other relatable ER stories we have. And we're such a community that I was like, let's just share some more ER stories and some shit that just pisses us off and just to have a little vent session before we get into like some of the other fun stuff. So, Dom, I'm gonna start with you as our special guest extraordinaire. What is
You
something
know,
that you experienced like when you were at the bedside that just like ticked you off? Like,
I'm just gonna dive right into it. We go straight for these doctors, piecemeal and everything. What would drive me insane is that you know where we're going with these patients. You know that they're septic. You know you want to do all these things, but they're gonna let's wait for some lab results to come back, and then we're gonna go draw those blood cultures. Let's wait for that lactic, not quite yet, and then we're gonna go do it. Piecemealing to me drives me insane. You're a physician, you're here to practice medicine. I'm all there to support you every step of the way, but if you piecemeal me, it's gonna take me forever to get everything done. I want these patients well taken care of. I'm okay. And those doctors that want to blanket everything, I don't agree with that either. But you need to look at the clinical picture, treat your patient, and then we're here to support you every step of the way. So that's really what grinds my gears.
But
Felicia?
don't you think that that can be a little anxiety on their part, Dom? Because I think when they piecemeal, I think they're trying to like, I don't like it either, but they're trying to almost like figure it out. Oh, okay, wait a minute. This patient comes in and they have this. So I'm supposed to do this. I'm supposed to do this. And they start piecemealing it. But I think I find it that they must be under some type of anxiety because I've had physicians in a trauma. Literally, I could see the wheels turning, and they're, like, calling out everything they could think of for you to do, but there's only about 4 people in the room trying to do the stuff everything that they're saying, which, I mean, it's insane. It drives me crazy. Some things can wait until they come back from CAT scan, like the life-saving Foley catheter. Right. It can wait. Or even the EKG. Those are not primary things we need to get done. So I get what you mean on that. Like, we do it enough for them to just go ahead and say, if you know you're headed towards that sepsis workup, let's get them cultures. Let's
Hmm.
go ahead and do it. Let's stop this waiting on you're going to admit this patient. And now that admitting physician is like, did you do cultures? And you're like, probably lying to them. Yeah. And now the cultures need to be done, yet we've given antibiotics.
Hmm.
So
Yep.
I
no,
do
that's a
agree.
great one. Yeah. Oh my God. That drove me nuts when I was like on the floor and you're just like, are you kidding me? I just came out of the room and now you want me to go back in and get this lab,
Hmm.
just your labs. Like, I just did this. Like, are you kidding me right now? Like, obviously, it's different. Like, if you did something and the labs came back abnormal and they wanted something different, like, that's,
Right.
but like, yeah, when you're talking about like, you know what you want to do, like, why are you just putting in an order here and there? Like, that's
Hmm.
flipping annoying.
I agree.
It's
Drives me.
maddening. What's your one of your pet peeves, Felicia?
Well, besides that one, I am not an advocate for anybody showing off in a setting. And when I say that, I've had physicians that needed to do something on a patient emergently, as in the patient needed to be intubated because they had angioedema and their tongue was blocking their airway. But at the same time, this lady had all of this blood coming. She was actually suctioning herself. I'm gonna be honest. She was like, came in, she was like suctioning herself or whatever. And now it's time for us to go ahead and put a tube down her throat because it's like starting to like really block her airway. So we get everything set up for intubation or whatever. But of course, the ER physician couldn't really intubate the patient and we needed to call anesthesia, which we did. So anesthesia comes down. But what I was seeing was this sudden cocky behavior and showing off. And that's a problem for me because to me, it's not the time. And then things start going on that are unnecessary. And we all know that Felicia's eyes, her nonverbal cues are really, really something that gets her in more trouble than her verbal cues. So I am like working on that. Anyway, neither here nor there. I was in the middle of doing an ultrasound IV on a patient who only had maybe like a small 22. We need a little more in her trying to get the ultrasound in. And I watched the physician literally throw something across the room, which was not something that I'd ever seen this particular physician do, which made me feel like you're showing off in front of all these people. And I gave him one long blink that he knew I was very bothered by what he had done and that I felt like you're doing this as someone that's showing off in front of anesthesia who's down here in a room full of people. This is not necessary. I will tell you that after everything was done, he did come and apologize to me because I know that the look on my face said, "You about to get it, but I'm not
Yeah,
gonna do it in front of everybody.
that
I'm
blink
gonna
gets anyone.
It's
That blank is scary, everybody. You need to know it. If you ever get a long blink from me and my eyes are closed, you're about to get it. Just let
yeah.
you know.
Run.
I've seen
But he
previews
realized.
and that's scary enough. Like, I don't wanna be on the receiving end of that
No,
volunteer.
so that's what I don't like. Just don't. I think everybody knows their role, and we just don't need to do that. We just need to do our role, and that's to care for the patient.
Exactly. Love that.
How about you, Brittany?
I would say it's tough because I mean, I feel like we're kinda shitting on the providers, but obviously we love everybody.
We
Um,
love you,
but
but
it's
We do.
struggle when you're trying to advocate for your patient, like, something's not right and you're like, they need this or they need that, and, like, your provider's just not listening to you. Or, you're super busy tied up with this one critical patient and the provider, like, comes in and to find you, like, knee deep in giving meds or doing something else, and they're like, "I need a urine from room 52." And you're like,
and you
"I'm a
still
little
need that
fucking
urine,
busy right
sir.
now, like,
Mhm.
give me a break, like, I'll get to it when I get to it, it's priorities."
Right.
Like, just because you have, like, something you need to do, like, I've got patients too that I need to prioritize.
Absolutely.
That drives me nuts. Like, we're a team, and I hate oh my god, my biggest pet peeve is, like, when people are just, like just that mentality of, like, "I need to do this for me right now, blah, 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 and nothing else matters with the whole team," because that just ugh, that will, like, throw me over the freaking edge by far.
Mhm.
What
I
about,
agree.
like, patients? Like, what kind of patients, or, like, family member things have you seen or done that are just cringe cringe-worthy? We already talked about obviously like the patient coming up to you while you're doing compressions and asking for a warm blanket when you're in the middle of saving somebody's life. What are some other things patients have done?
Oh, honey, I have plenty of stories.
Do tell,
I
spill the
mean,
tea.
one of my pet peeves is this. I understand as the caregiver, whether you're a family member or the caregiver that's not a family member and you're there with your loved one being treated. And you, hit the call light or you step out of the room, which is also a pet peeve of mine. You don't step out of the room. And this is why we give you a call light. Okay. We're discussing other patient information and there comes the HIPAA violation. So we need you to stay in the room and we need you to use the call light. Anyway, as the nurse, you go in and they're like, my mother needs changing. Or the caregiver's like, I think she's wet. Here's my thing. Yes, I'm the nurse more than willing to change mom, dad, whomever it is. And you're the caregiver at home. I know you need a break and you're a little tired, but I do feel like you could offer some help. Like you could offer, even if you're like helping to roll mom while I'm cleaning her and getting things settled. But to step outside the room when your loved one needs to be changed and you're doing this at home, because you have to remember we need to get everybody back to their normal ADLs. Okay. Oh, I just feel like that's aggravating that you don't when a someone that cares for you already is not even offering to assist with their loved one. And you're sitting there, you're just going on to step outside the room like go for it. You get her cleaned up. And you can't she can't roll. You're trying to get her rolled. It would be nice to offer a helping hand. So for those of you out there who are listening in and you're a caregiver, a family member, offer that nurse some help. You help mom, dad, whoever out at home. We need help with your loved one too. That's a pet peeve of mine.
I couldn't agree more, Felicia, because we've almost created this expectation of like when they come in that we are going to do everything for them.
Right.
And while we are here to care for your loved one and care for you as the caregiver that's at bedside, we're not here to do everything for you. There is a baseline of like ADLs that you need to be able to maintain and care for yourself when you are in the hospital setting. Now, if you're
Absolutely.
completely knocked out and you're super sick, we understand
Well
that.
saying.
But at the same point in time, if you're that caregiver, I'm not asking you to clean them up and do everything,
No,
but that helping hand would be so helpful.
that's all I'm saying. How about you, Britt?
It is hard. Another one of those things where you're like, there's so many things like I could say, but like trying to narrow it down to a couple. I think it is hard. One of the things, I've worked in a couple different ERs and a couple different like layouts, and it does make it difficult when you don't have kind of like that, inner shell and outer shell, that thing, and patients, family members, and everybody's just kind of like up and down, in and out because it gets hard when you're having to communicate with staff members and physicians and everything like that at the nurses station. And then you just have people like continuously like standing there or right there. Like you're not able to kind of have that communication. So like if you need something, please just like use your call light. Like it's so stressful and it's really like hard when you keep coming out of the room when we're trying to communicate about patients and trying to, maintain people's privacies and all of those things at our, nurses station, but we can't do that because you're constantly there and we're trying to like take care of people. So like that's probably up there in my pet peeves or I feel like the other thing that we can all say is, those patients that come in with abdominal pain or like they've been vomiting all night and the first thing they're asking for is like, "Oh my god, please, like, when can I get a sandwich?" And you're like, "You're here because you've got belly pain, you've been vomiting, and now all of a sudden you're asking for a sandwich?" Like, that's not how this works. Like, all of those things are just so, like, frustrating. Frustrating is a great
I couldn't agree more. I couldn't agree more.
I would say for myself, like my biggest pet peeve is just people not being respectful or kind to us.
yeah.
We treat everyone the same. We treat everyone with respect. I could care less how much money you make, what income
Nope.
level you are, if you're a VIP or not.
I don't care about that either.
I treat everyone the same
Me
across
too.
the board. I
Me
treat
too.
you as if you're my own family member because I would never want anything to happen to my family or myself if I enter a hospital. So, my biggest thing is just be respectful and kind. I understand that these are stressful situations. I understand that you're here for what X, Y, and Z that caused you to be here, but I'm also here to take care of you. And if you're being disrespectful or rude, it just makes it more challenging. I'm still going to care for your loved one just the same, no matter how difficult you can be as a family member. But being respectful and kind will get you a lot farther and a lot longer than being rude.
And
And
we'll
that's
get you
just,
a sandwich from me.
there you go.
I mean, and it's the truth. And I do need you all to know, for those out there, family members, I need you to stay in the room. We cannot walk the halls of any unit on our phone pacing as if we live there. Not only does it show disrespect, but there's patient information, there's things going on And if you're walking the halls on your cell phone in an emergency room or on the unit, that can create a problem. I need people to stay in the room, use the call light so either your tech or your nurse can come in and assist you, but we just can't be on the phone out in the hallway. We just can't. That has to stop.
And it brings me to my other like, another pet peeve of mine too is, like, we have patients sometimes that have very numerous amounts of family members, and when you're getting inundated by every single family member that is calling to ask for an update, like, that is absolutely drives me crazy. Appoint one contact person, please, one person that could be the main source of information, because it takes away so much time to have to constantly, like, be addressing every single person's questions and everything you just told this story to, and now you gotta repeat it again for Mima, and then you gotta repeat it again for Auntie Susie, and then you gotta repeat it again for cousin Billy Bob. Like, I don't got time for that. Like, I'm trying to take care of your family member. I don't got time to, like, tell this story 452 times. Like, find one person to be your spokesperson so we don't have to waste that time and we can actually care for your loved one.
Absolutely. Couldn't agree more.
Agreed.
There's so many. I feel like we're talking and I'm like, it's all coming back up. I'm like, so
Yeah,
frustrating.
I'm like, we could do this for like 100 episodes. I'll be honest.
I know.
absolutely. We could go on about things that, yeah, need to be addressed. And I mean, I'm sure they will never change, but these are things that are
It's
pet
hard
peeves
to
of your
do.
medical staff, just so you know.
It is. It's so hard because I feel like we've probably talked about this before, but like healthcare's changed a lot, obviously, in the last 10 to 15, 20 years. And it's just so different. Like you have patients and family members that are coming in that are like, I don't know what a better word for other than like entitled, right? And it's like
Entitled.
calling about
Perfect.
them as just like being kind and courteous. Like I don't know a time in healthcare where like nurses are ever taking the amount of like verbal abuse that they're taking right
Abuse.
now. Like
Not
we're
only
here
verbal,
to like
physical.
care for people, and like all of a sudden, like you go into work every day and you're just getting like verbally attacked by people like nonstop, and it's just like uh, I don't even know. Like that's just that's hard. Like I don't know how like people deal with it. Like people are not dealing with it very well. Just like be kind, be a nice freaking person. Like we're all just
We
trying to do this
just
together.
we just had somebody show up to the ER doors recently and demanded that the only right reason he's going to check in is if we can sorry. The only reason he could check in is make sure that his wife is guaranteed to stay with them from step A to step B. I'm like, I can't make a guarantee for that. I'm like, we don't know what's going to happen throughout the hospital stay. And at the end of the day, if you were admitted and you were like, hey, can my wife stay? More than likely, my answer is going to be 99% of the time. If you were respectful and kind,
Absolute.
it's going to be a yes. When you start making demand at the ER door and start being like, well, I'm not coming in unless you can guarantee me, well, I'm going to continuously say, I'm not refusing you. You are more than welcome to check in, but I can't make a guarantee for you. That, like, we
Absolutely.
have come to that point of like VIP expectations and that entitlement of, I'm going to get this, or too bad, so sad. And I'll write a bad review on your hospital. I'll come for you. At the end of the day, I'm here to take care of you. Come on in. What did I do with that family member? I said, I can't make a guarantee, but I will assure you every step of the way that she can be with you, she will be with you. And he was completely fine with that. But we did get him admitted, and she did spend the night. But come with respect and kindness. It's going to get you so much
Absolutely.
farther. You would never even have to have that discussion. As long as you're kind and courteous throughout your stay, you can have her stay with the night, no problem. I'd be happy to have your loved one stay
Absolute.
with you.
What I always say, more with sugar than you do salt. Come in sweet. If you're coming in sour, more likely you won't be staying overnight. Just saying. You
Well,
know? So
hard too. Like I mean, we could once again spend a million different episodes on this one, but like that downfall of kind of where healthcare's gone to, and it's I don't know if it was when we started doing this patient satisfaction surveys. And please don't get me wrong, like obviously it's important to know that people are happy with the care that they're receiving, but I don't know if that should be the end all be all of everything, and that's kind of how the industry's going, and it makes me nervous that it's not so much based on the care people are
Care.
getting, but the perception of the care almost in a way they should go hand in hand, but sometimes that's not always the case. And
Right.
it's very concerning, I guess, that kind of how much those things are being tied into, hospitals reimbursement and all this kind of stuff that it's being tied into. So it's a very weird time out there right now. And I just don't want it to get worse for healthcare workers because it's already tough. Like people are rough, man. They're just rough. I don't know a better word to say. They're
I
just
mean,
rough.
they're not only can be verbally abusive, they can be physically abusive.
Yeah.
They really
Happens
can.
way and that happens way too often, and no matter where you're at, if you're a healthcare worker, you at least if you haven't been assaulted yourself, you've seen somebody or heard somebody within your hospital. There's not one hospital out there that hasn't had,
Absolutely.
workplace violence, and that's sad.
It is because nobody should be putting their hands on anybody. I don't care. They just should not be doing that. We're here. We're there to help you. We want to help you. Sometimes people come in already angry, and I think I've discussed this in a previous episode, walking in early in the morning and somebody's already giving you an attitude from the minute you've introduced yourself. I immediately, and I'm here to tell you what put a stop to that because we're going to walk right back out that door. We're going to knock on that door and we're going to start over because you're not going to ruin my day. Okay. I got 12, 13 hours to go and it's 7 o'clock in the morning and you're already snapping my head in the doctor's office. We're going to stop right then and there. I'm going to say, you know what? We're going to walk back out that door. We're going to start all over again. And that's exactly what I do. And I found that it not only shocks the crap out of the patients, but the doctor is like, what do we do? We're going to walk out this door. We're going to start over again because we're not going to allow anybody to ruin our day. We're here to help, you know? And I'm serious about that. I'm serious about that, just like I am with the call lights. There is call light abuse, people. You need to know that. I am not an advocate for call light abuse. If you need to use your call light, it is there for that reason. But you have to remember that your nurse is not only caring for you, she's caring for multiple patients. And you all are important, and we want to make sure you know that. But if you live on the light all the time, what do you think happens? Burnout from it. People can't help but ignore after a while. So I need you to be careful of your call light abuse. Use your call light wisely. Okay. That's
I
my
think we
take
know where
on it.
she stands on call lights, guy.
Yeah. Yeah. My whole take on call lights was if you abused it, I would go in. No, I would go in and I would say, go ahead and hand that to me. I would. And I would say, look, we're just gonna take this away for a couple minutes, okay? But we're watching you, like we're walking right past. But right now, like what you're doing is call off abuse. It can be just, you know, overwhelming for all the medical staff. We have everybody's important. We want to get to everybody. And sometimes we can't if the call light is being abused. And they look and then they say, okay, but then it stops. That's just a little something that
Felicia's cracked the code of how to get through all the difficult patients. So if
well, you
you
have
have
to
any
figure it
problems, let
out
Felicia know.
so
She's
that it
got you.
doesn't
Yeah,
ruin your day.
don't let
I'm
them ruin
all about not ruining my day because one person can ruin your entire day and you be so angry now you're not meaning to, but those effects are shown on to your other patients. I'm not doing that. We're not going to have anybody ruin the day. That's just my take on it.
Nope, every day is a good day,
Every
no
day's a
matter what
great
comes
day.
through, 'cause we got problems, we're gonna take a step right back out that door. We're gonna start over again,
We're starting
fresh,
all over again.
and
What
we're
we're going to
golden
do,
again.
everybody? We're going to walk out that door and we're going to knock. We're going to walk in. Hi, my name is Felicia. I'm going to be your nurse. And you are? And what brings you to the emergency room or whatever, whatever? It just changes everything.
Yep.
We all have bad days, wake up in bad mood. It's human nature, but it's not okay to take it out on someone else. It's just not. So that's how I see that.
That
That has worked.
that's your tip for the day, folks. We
That
can't
has
get any
worked.
better than walk back out and walk back in again.
Start
Instead
over.
of walking back out and not going back in. So
Mhm.
I figured let's nip it in the bud
I
and then
love
we
it.
have a nice day.
I love it.
Yeah.
My gosh. Yeah, there's so many stories. Like, I feel like we'll definitely keep like bringing this back up because it's just fun to commiserate with like other ER nurses and other people who get to experience it too. Because when you have none, like all of us have partners that are not in the healthcare industry. So when you have like a significant other, or somebody who's not in the healthcare industry, they just don't get it.
I
So it's
just don't
always fun to
understand.
be able to like relate to somebody who like truly understands when you're saying this stuff. They're like, "Oh, yeah, I can see that patient." Or like, "Oh yeah, I understand why you're upset." Like it's just, yeah, crazy.
So, Dom, someone like yourself in your role currently, you have to deal with many family or patient situations where someone is not happy. How do you smooth something over that you know that that patient or that family member was not right in really what they did or
For sure.
said?
That's a really great question. I actually encounter this quite frequently. But you got to get both sides, right? There's always their side, and then the right side that's in between. You have to
Mhm.
be the one, especially in my role, to delineate like where's the truth and where the lies are. I support my team every step of the way, but we have to
Mhm.
be honest that not everyone follows that respect
No.
and the trust thing that they should be doing. There are times where we get heated and we make the wrong decisions. So I'm always going to go to my team first. I'm going to get their side first. I'm going to ask them straight up. Do you feel like there's anything you could have done differently? Okay, because I'm going to go walk in and I'm going to talk to the family. I'm going to get the family side. I'm going to listen to them, hear them out. And then I'm going to, if I can bring them both together, that's the goal. I'm going to bring you both together and we're going to find out where this is. If it's too heated and too stressful, that situation, I'm going to keep them separate, but I'm going to diffuse both situations, right? I'm going to diffuse my team member. I'm going to diffuse the patient's issues, and we're going to find that common ground. There are times where our patients and families are manipulative. They say the wrong things, they're going to do the wrong things to get the outcome that they want.
Right.
Sometimes it does burn you when you make the wrong decision, but you always have to go in good faith. And my biggest thing is everyone safe right now? If everyone's safe right now, that's all that matters to me. Now we can have discussions and we can move forward to see where are the fallouts that you felt that we had and where can we go moving forward. We're going to develop a plan. That plan is going to include the family members, whether they're manipulative or not. I could care less because that plan is going to set us up for success. I'm including you in the care decisions that need to be made. I'm informing you every step of the way of what's going on with your family member and loved one so that you can make the correct decisions. Most of the time, it's going to be doctor driven orders that are going to be partial of the issues. If I can bring the doctor in, if I can call him in on the phone and we can all be on that same page, that is wonderful. Usually, I would say about 95% of the time, it's always going to come down to miscommunication.
Okay.
Well, I told the night shift nurse it was this, and I come back in the morning, and why didn't we do that? It never got transcribed in report. I'm sorry about that. We're going to make sure it's in there. We're going to physical order in there. I there are orders for my mom to get this medication. Why didn't she get this medication? I see it's time for nighttime. It should have been time for daytime. We're going to fix that order right now. It's whether it's communication orders, whether it's your handoff reports. That's why bedside shift report is so important. Communication is the majority of all of these issues that it stems from. Yes, we have a lot of other issues outside of that. There are procedural areas and stuff like that, but the majority of issues that I encounter in my day to day is always going to come down to communication. Where is
Okay.
that lack of? And usually it's the family member that wasn't there during bedside shift report. Now they're coming
Got it.
in and now they're seeing that loved one and not getting what they needed or what they told the night shift nurse or the nurse before that. It happens quite frequently. We develop a plan, we write it out, we're on the same page. And when we move forward, as long as we follow that plan together and we're continuously informing the patient and their loved one, I don't really have to go back and deal with any more of their issues. Communication is key in our roles, no matter if you're a PCT, you're the EVS worker that's at bedside, you tell them every step of the way of what you're doing, and that makes them feel more comfortable. Hey, my name is Dom. I'm here from EVS. I'm here to clean your room. Is now a good time? Great. I'm going to start with the floor of the bathroom. Then I'm going to finish with all the bathroom stuff. And then I'm going to come do your floor and your bedside table. Simple as that, letting them know what's coming. They're happy and that we can move forward.
So communication is definitely the key, keeping people
Mhm.
informed, right?
I'm
They
I'm
love
pretty
that.
sure I say this every episode that I'm on. Communication, communication, communication.
Communication.
She's
I
call
love
like
it.
queen. one of these squares. She's call like queen. I'm communication king. Okay.
Okay, I love it. I love
It's
that.
so true though. Like literally, I feel like any problem, pretty much any problem that you can think of, it's because of some form of communication breakdown. Like so key, and so few people have mastered how to communicate effectively. It's going to be a problem from now until eternity, I think. And it literally comes down to that all the time.
You see that? That's a loop. We close that loop every time. You got no issues.
But what I love that you said was you're getting both sides of the story. Do you know how often that doesn't happen? And that's not just in a situation where it's patient, staffing issues. It can be even with leadership and team members. Like communication is huge. And I think it's important that we always hear both sides because then we can figure out where the breakdown occurred. But do you know that doesn't happen that often? So thank you for being that person to say, you know what? I want to hear what my team has to say. Then I'm going to go in here and I'm going to go in here and I'm going to talk with the patient so I can figure out where the communication breakdown 9 times out of 10, that's what it was, communication breakdown. I absolutely love that. And I do find that everybody could take from that, no matter what your role is. Sometimes it just occurs where there's a communication breakdown, something somebody didn't listen to, didn't follow through. And I do think it's important when the middle person comes in to get both sides of the story to come up with a resolution. So thank you for that.
Yeah. And then
Hope that you
my
spread
other
that.
thing is like when you have codes and stuff, right? Like we're not always on the same page on codes.
Nope.
Communication at the end, that debriefing. That debriefing goes
Yes.
so far and it's so great to get everyone's input in there to understand where we can move forward.
And why did it take so many years for them to figure that out?
Hmm.
Because it did. But it is a great tool for
A
any of
wonderful
us to
tool.
figure out what we could have done better, you know, or maybe it wasn't something, but just talking about it. It really does help. So thank you for that. Yeah, I like that a lot.
Aw, my heart's
I
so
do.
happy. Aw,
Yeah, that makes me happy because it doesn't happen enough where we listen to both parties.
that's why you
And
have
Yep.
to
then
And we should.
listen
we should
in. Remember, that's part of what we talk about here is
listening,
grabbing and listening in.
listening. And
Listen.
you know, us as nurses, we have a tendency to not listen to the whole thing all the time. So I think that's important to have that person that's listening and, like you said, being able to resolve the issue. I love that. So thank you for that, Don.
Thank you.
All right. Well, I think it's time for probably our favorite segment of the show. We are going to
Drop it. Drop
drop
it.
our
Let's
stethoscope
go. Boom.
and get
Talk about
down to
whatever
the
you
real
want to talk
biz.
about. Brittany, do you have anything going on?
Literally, I feel like all I do is, go from one side gig to main gig to side gig to main gig. I don't really know. I work a lot. I did take a little trip to Disney. I don't know at this point. So that's my little reprieve. But other than that, I'm just literally working all the time. So it's great. It's fun. Got the Christmas tree up. Pretty excited when we talked. We were talking about Christmas
Loving it.
around, and I'm very excited. I love Christmas. So
Me
Christmas tree
too.
decorated, but it's up.
Ooh,
So
I
girl, you're
love it.
what?
behind.
Yeah, I was like, what? One step at a
I'm
time.
behind. I'm behind. Yeah.
Tom, what's going on with you?
Well, we're fully decorated for Christmas over here, so you'll need to step up your games. We got our tree up, we got our Santa out, we are ready to go.
I love it.
My thing is, I just want to represent. So, No Shave November is here, fellas, women. Just want to let you know that it is here. I was actually surprised where I work and how many people did not know what No Shave November is, or maybe I had a false understanding of what it meant to me. So for me, it brings awareness for prostate cancer and testicular cancer in men, and that's why I choose to do the No Shave November. In my role, there may be a time where I may have to shave this off if I'm going into an isolation room to have a discussion or to treat a patient right away. And I got my razor in the locker ready to go if I need to. But at the end of the day, I am here to represent No Shave November. Let's bring awareness to testicular and prostate cancer. And yeah, I'm a little patchy here. So I'm just gonna do what I can. And that's
I'm
all I ask
loving
that you
it.
guys do.
Love it, and it's for a good cause. That's what it's
Yeah,
Mhm.
about.
it's all about the thought about raising awareness,
Yeah.
like you said. I feel like there was a bigger push before, and I kind of like forgot
Mhm.
about it too because I don't know, it kind of faded away with everything else. But yeah, it's really important. Last month was breast cancer awareness, and talking about getting mammograms and doing all those things to do preventative care, and talking about doing testicular self exams and all of those things
Yes.
to do preventative health because obviously Felicia can speak firsthand about how important it is to catch these things early, so that they can be treated appropriately. So
Mhm.
thank you for bringing that cause. And for those of
I
you who
like it.
can't see him, Dom looks adorable. He looks great
Does.
his with
Amazing.
his hair. Yeah, it's a look. It's a look for
It
sure.
is a look.
Thanks,
I'm loving
guys.
Anything else going on with you?
Not really. I do have a vacation coming up. I know Felicia just came back from New York. After Thanksgiving, I'll be going to New York for a
Oh,
little bit
that's a
of
great
time.
time.
Yep.
Yeah.
So everything will be up there, and yeah, we're just gonna live our best life while we're up there, have a good time, and not have to think about work, baby. That's gonna be my
That's it.
biggest thing.
That's it. Live your best life.
Were they
Hmm.
were they when you came back, Felicia, did they already have some stuff up or did they not have it up yet in New York? Like the Christmas stuff?
No, they don't. They wait until after Thanksgiving.
Mhm.
Like they have the tree,
Mhm.
but it's still wrapped. It's not up.
Mm.
It's not
Okay.
up yet. They were announcing about the family that, donated the tree this year and whatever. Wiregrass Mall here in Florida did the Christmas tree lighting actually Saturday.
Mm.
It was packed. I was, I think it was Saturday. Yes. Yeah, they did. Saturday evening, I want to say. Yes. So, but no, not yet after Thanksgiving. I think somebody said early December.
Okay.
Yep.
Sweet. Well, yeah, I mean, the big topic right now, Felicia, is what is going on with you, girl? We need some life updates.
Yes.
It's been a little since we
Okay.
talked. Like,
Well,
things in. What's
well,
going on?
first of all, I don't have my Christmas decor up because I have just returned back from New York. Okay. We had to ship 5 boxes here and then
Acceptable.
we came home with 6 bags of luggage.
Acceptable.
Accept.
But it's okay because this week all 7 trees are going up. Even though I
7.
did not plan that. Had you asked me that maybe a couple months ago, I would have told you it's not happening this year. But I've decided it's going to happen. I love Christmas. I'm trying to think of a new theme. I like to have one room that's on to a different theme. I just haven't really taken the time to think it through, but it's bound to happen. Don't you worry. By the next episode, those trees better be up. So somebody better get in that
Mhm.
garage and get to getting those buckets down.
I think we know
So
who.
that's a little bit about me as far as Christmas. I'm not there yet, but I will. As far as health wise, I have finished all 25 of my radiation treatment. Yay, I rang the bell. A very exciting moment for both myself and my husband, Anthony. Truly amazing. But at the same time, the excitement of coming home back to Florida, the sunshine, missed it, don't realize how much you take something for granted until you don't have it. Okay. Traffic that we've always complained about here is nothing compared to what you deal with in Manhattan. There'll be no more complaining from the Gainies when it comes to traffic. You'll just suck it up, buttercup, because you know what? That ain't traffic. Okay. And be appreciative of turning right on red. Okay. You cannot do that in Manhattan. All right, because all your people are walking the crosswalk. And when I say they don't wait, jaywalking is a real life thing. And I love it. Just know I love it. So that's kind of the thing with my health as far as finishing up the treatments. I will tell you the oral chemo was brutal on me. Now that I'm back, it's sitting in with the radiation, which they oftentimes tell you what happened. The fatigue starts sitting in. I've been having some like gut punching epigastric type pain that comes at night, depending on which side I'm laying on. I do believe, and I've spoken to the doctor about it, could be a little gastritis. Trying to treat those symptoms, however, they bring me to my knees. I'm gonna be honest. Anthony typically has to rub my back. Can't sleep on the left, can't sleep on the right, and I don't sleep on my back. That's very difficult for me. But I do have a doctor's appointment tomorrow and I will be asking for a CAT scan. I know you all want to know what's going on with that tumor. Well, so would I like to know. However, radiation says that they do not see results from radiation, the radiation oncologist, for 6 months.
6
Ooh,
months?
So they won't even do a CAT scan until April, which gives me
wow.
anxiety. I'm going to be honest with y'all because, as ER nurses, I want to know right now what's going on with that tumor. Okay. But he says 6 months is when they really do see the results of it. I have to be patient on that part. However, I am going to be asking my physician tomorrow to do a CAT scan because just because I'm saying it could be a little gastritis, just because he said it could be a little gastritis, the physician in New York, nobody knows because they can't see a picture. So I need to know because that's just who I am. I believe that we don't have pains for no reason, discomfort for no reason. It's your body's way of telling you something's going on. Maybe it's nothing bad. Maybe it is something from radiation. I don't know. I would rather them tell me that based off of whatever results they get. So I'll be asking for that because this time I'm starting to experience nausea and vomiting, which is something I've never had the entire time through chemo. So that became a little concerning for me. Could it be radiation? It could very well be from lingering over from radiation. I don't know a lot about radiation. I think I told you a previous episode, but it is doing its thing because your pigmentation of your skin shows it after a while, and I can so see it all the way around. And even though they're doing targeted radiation, come on, guys, let's be for real. Like you can try and target all you want. There's a lot going on in that digestive system. You can't tell me you're not touching other things that you're radiating. So that's kind of where we are. December 3rd, I will be having a telehealth appointment. Yeah, and I think they're going to be putting me on a PARP inhibitor, which is an oral chemo drug that's supposed to be a little stronger than the last one, and that one was brutal.
Are
I
you
am
still
hoping this
on
one
it?
won't.
Or did you end it when you
No, no, I'm off of that one. That one was supposed to be for 21 days. So I did radiation 5 days a week. I would do that 5 days a week and then off the weekends. But then it's like, oh, it's out of her body. Let's start all over on Monday. Well, then bam, here we go again. And you know, I'm no weakling, but let me tell you something. It knocked me down. Like it really, really did. Chemo, I'm gonna be honest with you guys. I never had chemo with breast cancer. I just simply just took them off. That was it. And I opted to do that. That was not something I had to do. And I'm glad I did. So this is my first experience with chemo with radiation. And my hat goes off to every male and female that ever has to go through chemotherapy because it is absolutely no joke. I told my family I don't think I could do it again if I had to, honestly. And I'm not one to give up, but it's brutal. It is poison. It's poison in your body to do its thing, but it is breaking your body down in more ways than you know, from head to toe. I mean, my taste buds, everything, everything. And it makes me feel sick on the stomach, and then you just I can't really eat. So the weight I thought I gained, I've just lost all of that, like so it's not easy. I always will stay positive about it because I'm very grateful for every step of the way and all the support that I have received and all the love. Forever grateful. God has blessed me. But that chemo, I just don't know if that's something that I would be able to put myself through if I had to go through that again. It is very, very hard.
so right now you ended radiation last week, flew home like just a couple of days ago, and then you're kind of, for lack of a better term, like, on a break right now from any kind
Yes,
of treatments?
from any kind of treatments. So from this time, so basically so Friday was my last treatment.
Mhm.
So from Saturday until he prescribes this new PARP inhibitor, which December the 3rd, but I probably won't get it on December the 3rd. I am not going to be on anything at that time. And then it will be like starting a new oral chemo
And that's gonna be every
drug.
day?
I believe so. That's something that I'll find out from him when we have the conversation on the 3rd, and just kind of like, when can immunotherapy or something be considered? Well, I guess those things aren't considered until all of your treatment is completed. So this is a long road. It really is. But, just try to keep moving and keep moving forward. That's all that I can do. But it is not easy at all, but it's not easy for anybody that's going through any type of cancer. I'm sorry. Like, I met so many people on these different journeys, and I mean, of all ages, nationalities, it doesn't matter. Like, it's getting everybody, and it's heartbreaking to see. I mean, it ranges 20-year-olds I see up until like 70 and 80-year-olds. And then I say, bless their hearts, these older and younger people, because this chemo is no joke. And I can't imagine having to put my body through that at that age. But let me tell you, this is why I'm gonna live my best life, everybody. Save for what? What am I saving for? Like, no, I'm going to live my life because tomorrow's not promised. And if God was to take me away tomorrow, I want to be, and I can say I've had a wonderful life. I can honestly say I've been truly blessed. I cannot, I will no longer be like, maybe we'll do that in March. Sorry. It will be no, if I can afford to do it, I don't get to take the money out or whatever, then I'm going to go and do just that. I mean, and I tell everybody, live your best life, because you have no idea when that last day will be. You don't. None of us know. And it's hard, you know? So that's my advice to everybody is party it up, honey. Because that's what I'm gonna do.
Who's
Is
Well,
your who's your appointment with
we
tomorrow?
Crescentini, the medical oncologist here in Florida. Yeah. Yeah. I actually walked into their office today because I wasn't really getting an answer. Like, their phones must have been ringing off the hook. It is Monday morning. And I was just kind of like, did you see me this week while I'm off work? And she was like, yeah, it's a 9 o'clock appointment. I said, I'll be there. So I will see him in the morning, and I will ask him to order a CAT scan and maybe order some Finnegan suppository because his old friend isn't working at all. So we shall see. But today's a better day. Yesterday was not that great of a day. So if ever you're texting or whatever and you're not getting response from me, just know it might be just a little bit of a rough day for me. That day. But today I do feel better. I do.
we love you, and
I
the
know.
fact that you're making it this far in your journey is amazing. I mean, the fact that you're still positive every step of the way that you
Oh,
can be,
thank you.
like, I don't know. I honestly, I don't know how you do it, but you're doing it, and I support you every step of the way because it is not easy, and you're the only one that's really going through that right now, and with us. But we're here. Anything we can do to help you, we're absolutely will. And I know you're gonna have some hard days. You're gonna have some good days. I want you to have as many good days as you can.
Well, I thank you guys, and that's how I'm getting through it because of all of you. That's how I'm like, honey, you better get it together. You can't be letting anybody down. You can't let these people down. Like, but it's not even really about that. Like, I feel like I have a lot of life still to live, and I want to live it and be here for my family and my friends. I'm not ready to go anywhere. Sometimes this is a wake up call. We need to really live life and stop putting things on hold, and maybe getting our faith together. You just never know what it takes to bring people together to do what's needed. And hopefully this will just be a testimony at the end, you know? I'm very grateful for you guys. I love you guys. You've always been there for me before this, during this, and I know after this. And we're going to party it up when we can. And it's going to be at a venue with a DJ, and the world is welcome to come. The world,
It's gonna be
Oh,
because
baby.
it's going to be a celebration.
I'm happy you're back home. Like it's nice to know that, you're here and you're not, thousands of miles away and
Right.
you're back with your community again and you have so much more like love and support here
Yes.
than you did when you were in New York. So I'm very happy
Absolutely.
you're back home and can't
Yes.
wait to like see you in person soon.
Yay. Whenever you guys ready, just let me know.
Future podcast, all three of us in person.
Yes.
Yeah.
Let's
I
do
know
it.
we've been
This is
doing a lot of
amazing.
this like virtual just because our schedules are all over the place and Felicia's treatments and everything. But yeah, like to get us in the same.
Now,
You think we're crazy like being,
Mhm.
over like Skype or whatever we're doing right now? Can you imagine us being together? Like we're
it's going to be great.
yeah,
It's gonna
actually
be a great time.
it's amazing. Let's be honest, it's amazing.
I thank you guys. I love you guys so much.
We love you.
I look forward to
You're
this.
a flip queen and yeah, we love you.
Mhm.
We love you so much.
Yes. All right,
All
guys.
right,
This
guys.
has been great. So
All right.
That
we're
concludes
ending
this week's
another episode.
episode. Like we said, like, share, subscribe, comment, all the things to keep it going. Submit your, stories so we can share them in the link in the bio. And we love you guys, and we'll see you next week.
And we love you.
Thanks for having me, guys.
Bye.